Good morning, welcome to this video lecture, and today we will discuss about the Circoviridae family that infect the Circoviridae virus that infect the poultry or birds. So first we will discuss about the general feature of the Circoviridae family. So Circoviridae family or Circovirus is the smallest DNA virus. Is the smallest DNA virus. Smallest DNA virus. Next one is it is the non-enveloped single stranded DNA virus. Non-enveloped single stranded DNA virus. Circovirus is the non-enveloped single-stranded DNA virus. Single-stranded DNA virus. This is the important. Only two DNA virus or DNA virus family are the single-stranded. That is the Circoviridae family or Parvoviridae family. They are the single-stranded DNA. Other family like the pox, herpes, adeno, they are the double-stranded DNA. Or they are the double-stranded DNA viridae families. And the size of the Circovirus is the 17 to 22 nanometer in diameter. (17 to 22 nanometer in the diameter). So this is the smallest DNA virus. They are stable in the environment. Stable in the environment at wide pH range. Wide pH range, that is the 3 to 9. 3 to 9. Wide pH range is for the establishing in the environment, and the wide and the resistant to higher temperature. Resistant to higher temperature, that is the 60 degrees centigrade for 30 minutes. 60 degrees centigrade for 30 minutes. And the Circovirus replicate in the nucleus of the cells. Replicate in the nucleus of the cells or dividing cell nucleus. Replicate in the cell dividing nucleus. So replicate in the nucleus of dividing cells. Nucleus of dividing cell. Circovirus multiply or grow only on the dividing cells, that dividing cell nucleus, and infect mostly the chickens, pigs or plants. Infect mostly chickens, pigs and plants. Chickens, pigs and plants. So this is the general feature of the Circoviridae family, and this one other feature, that is they have the icosahedral symmetry. Icosahedral symmetry. Icosahedral symmetry. So this is the general feature of the Circoviridae family. That is they are the smallest virus. This is the important smallest DNA virus. Smallest DNA virus, that is the Circovirus or Circoviridae family, have the smallest DNA virus. Non-enveloped virus or non-enveloped all virus include in the Circoviridae family, that are these viruses are non-enveloped or a single standard DNA virus or a single standard DNA virus. The diameter of the virus is 17 to 20 nanometer, 17 to 20 nanometer in the diameter. And these Circoviridae family members are stable in the environment at wide pH range, that is the 3 to 9. Wide pH ranges, that is the 3 to 9. And the resistant to higher temperature, that is the 60 degrees centigrade for 30 minutes. And the Circoviridae members are replicate in the nucleus of dividing cell. Nucleus of dividing cell, this is also important. And Circoviridae family mostly infect the chickens, pigs and plants. And Circoviridae family have the icosahedral symmetry. These are the general feature of the Circoviridae family. Then we discussed about the disease of Circovirus or Circoviridae members causes in birds. So the disease is the chicken anemia and caused by the chicken anemia virus. Disease is the chicken anemia and caused by the chicken anemia virus. Then discussed about the chicken anemia. Infection occurs worldwide in all countries. The chicken anemia virus infection is the worldwide and infect all countries of the world. The casting of the chicken anemia is the chicken anemia virus. This is the old classification. According to old classification, that is caused by the chicken anemia virus. In the new classification of the viruses, that is the avian gyrovirus first. Avian gyrovirus first. This is the important, that is the genus of the Circoviridae family. That are the genus of the Circoviridae family. Has been the member of the genus of the gyrovirus. Avian gyrovirus first. And the avian gyrovirus or the chicken anemia virus is the double standard DNA virus with circular genome. Circoviridae have the circular genome. Circoviridae family have the circular genome. So chicken anemia virus or avian gyrovirus first have the double standard DNA and circular genome. So chicken infectious anemia virus or avian gyrovirus first. In fact, infection occur worldwide in birds, especially in the chickens, and castive agent is the avian gyrovirus, that is the member of the Circoviridae family. Member of the Circoviridae family. Double standard DNA virus with circular genome. And mostly chicken infectious anemia is caused the aplastic anemia. So the name is the chicken anemia disease or chicken infectious anemia. The virus is not known to infect birds other than chickens. Most commonly, the chicken infectious virus or chicken anemia virus or avian gyrovirus first mostly infect the chickens, not other birds are infected. None. Only single serotype has been recognized. Only single serotype of this virus is recognized, but some low-level genetic variants has been reported among virus isolate both within or between the countries. Single serotype present, but some of the low-level genetic variants reported. Some of the low-level genetic variants has been reported among virus isolated both within or between countries. Then the transmission of the disease or transmission of avian anemia virus. The natural route of the chicken anemia virus transmission is oral or feces from the infected chickens. Naturally, the virus is transmitted to infected chickens droplet or feces. Horizontally by the direct contact or contaminated fomites. Horizontally, infection is done by the direct contact of the infected birds and contaminated fomites also transmit the virus. Horizontal transmission is through the inhalation or the oral exposure, and virus is shed in the feces and feather dander. Virus also shed in the feces and feather dander. So virus horizontal transmission is done by the inhalation or the oral exposures, and virus is shed in the feces and feather denders. These are the most chances to other birds are infected by the virus sets like the dropping or other discharges, and by the feather dander etc. are infect the other birds. And the transmission of the chicken anemia virus also vertically through the eggs, also through the vertically. This is also important, that is the vertical or horizontal both are transmission is occurs in the chicken anemia virus, horizontal or horizontal and vertical. Both transmission are in chicken anemia virus. So the main route is the or natural route of the transmission, that is the oral or feces. Also include the feather dander or shed in feces, or direct or contaminated fomites also infected horizontally the virus, and horizontal transmission is through the inhalation, oral or oral exposure, and virus is shed in the feces and feather danders. And the virus also transmit through the eggs if the laying birds are infected. If the laying birds are infected, if laying birds are infected, the decrease the egg production, But if the recovered from the disease or infectious anemia disease, the birds are normally laid down. Then the clinical symptoms of the disease. Clinical symptoms of the disease. It is an acute immunosuppressive disease. It is the acute immunosuppressive disease. This is the important. This disease is the immunosuppressive bird disease. One another disease of the viral disease that also the immunosuppressive, that is the infectious bursal disease. Another is infectious bursal disease. They discuss the later about the infectious bursal disease. So, two diseases that are the immunosuppressive in birds, that are the infectious anemia virus or the infectious bursal disease. You always remember about that the immunosuppressive disease, disease of the birds, disease in birds caused by the viruses, that are the uh, infectious anemia, chicken anemia virus, or the infectious bursal disease. Then Uh, it is an acute immunosuppressive disease of young chickens. This is the disease of young birds. This is the disease of the young birds. Mostly infect the young birds. Chickens of the 2 to 4 weeks. Sorry, this is not 24. This is 2 to 4 week. 2 to 4 week of age are infected and develop anemia. Chickens of 2 to 4 weeks. Sorry, 2 to 4 weeks of age are infected and develop anemia. Infected chickens have motility approximately 10 to 20%, and if the secondary bacterial infection is occurs, motility up to the 50%. If secondary bacterial infection is occurs. So, infected chickens have the motility of approximately 10 to 20%. Normally, motility is approximately 10 to 20%, but up to 20% if the secondary bacterial infection is occurs. The surviving chickens recover from anemia by 20 to 28 days post infection. After infection, 20 to 20 days after infection, recovery of the chickens are started. 20 to 28 days infection after the infection, the recovery will start. So this is the clinical symptoms include this is the acute disease and immunosuppressive disease of the young chicken. This is the disease of the young birds and mostly infect the chickens. Chickens of the 2 to 4 weeks of the age are infected and develop anemia. Infected chickens have motility approximately 10 to 20% and up to 50% if secondary bacterial infection occurs. The surviving chickens recover from anemia by the 20 to 28 days post infection. So this is the clinical symptoms, and these are the clinical symptoms characterized by the anorexia. Mostly, first we seen in the birds, that is the anorexia. They stop the eating, lethargy, dullness, or depression. Lethargy, dullness, then depression, anemia. The body of the birds is become a pale. That is anemia, atrophy, and hypoplasia of the lymphoid organs, cutaneous, subcutaneous, intramuscular hemorrhages is also occurs. Increased mortality of bird. Normally, 2 to 4 birds routinely die in a flock, but increase the mortality of the bird is starts. So characterized by the chicken anemia viruses, that is the anorexia. First we will see notice that is the birds stop the eating, then the lethargy, depression, anemia also seen by the, and anemia is diagnosed or detected by the body color of the or skin color of the birds is converted pinkish to pale, pink to pale. Atrophy, hypoplasia, and atrophy or hypoplasia of the lymphoid organs means decrease the size of the lymphoid organs. Cutaneous, subcutaneous, or intramuscular hemorrhages also present. Increase the motility of birds in birds normal in or normal birds. And other clinical symptoms include and some birds may gain the adverse weight. Some birds Some birds adversely adversely affected weight gain. Adversely affected weight gain. So this is the by these symptoms we characterized the uh, chicken anemia virus. Then cross lesion, thymic or bone marrow atrophy of the thymus and a bone marrow, or um, the cell produced from the bone marrow, they are atrophied. Less commonly bursal atrophy. Sometimes bursal atrophy also occurs. Chicken with severe anemia, hemorrhagic aplastic anemia syndrome, as characterized by the intracutaneous, subcutaneous, or intramuscular hemorrhages, can also occur. Sometimes, not always, sometimes intracutaneous, subcutaneous, or intramuscular hemorrhages also present. So gross lesion is the thymus or bone marrow atrophy. Less commonly bursal atrophy may be seen in the some birds. Chicken with severe anemia, hemorrhagic aplastic anemia, severe anemia, hemorrhagic aplastic anemia syndromes also seen, and these characterized by the intracutaneous, subcutaneous, or intramuscular hemorrhages also present. Then next one is the histological lesions. Histological lesions. So histologically, generalized lymphoid atrophy. All lymphoid organs are atrophied. All lymphoid organs are atrophied, and depletion, pain, myeloptosis of the bone marrow. Pain, myeloptosis of bone marrow means those cells, they are produced by the bone marrow, they are atrophied. So generalized lymphoid atrophy, depletion, and pain, myeloptosis of the bone marrow. So, pain, myeloptosis is the cell that produced from the bone marrow, they are atrophied or decrease the number of those cells. Next one is the blood may be watery and clot slowly as consequence of the thrombocytopenia. Blood may be watery and clot is slowly. If the blood is the watery, the blood cells or fibrin is the concentration of fibrin and blood cells are decreases, so clotting of the blood is slowly as consequence of the thrombocytopenia. Secondary bacterial infection is common. Secondary bacterial infection is common. So the in histological lesions, the generalized lymphoid atrophy, and depletion, and pain, myeloptosis of the bone marrow, pain, myeloptosis of the bone marrow. Blood may be watery and clot slowly. Blood may be watery and clot slowly as a consequence of the thrombocytopenia. The secondary bacterial infection is common. If the immunity is decreased because of the chicken anemia virus is the immunosuppressive virus, or decrease the immunity of the, or suppress the immunity of the birds. So most commonly, if the immunity, our immunity is the depressed, so bacterial infection is commonly seen or in this disease. So that the because of the immunosuppressive secondary bacterial infection is done. Um, Next one is the diagnosis of the chicken anemia virus. Most commonly, the diagnosis is based on the history, clinical sign, and gross and microscopic and pathological finding. So diagnosis is based on the history, clinical sign, gross and microscopic and pathological finding. Viral DNA is radially detected by the PCR. Viral DNA is radially detected by the PCR. Viral antigen can be detected in the tissue, by immunohistochemistry. Immunohistochemistry using virus-specific antibody. First, we will detection of the viral DNA by the PCR. Detection of viral DNA by the PCR. Then viral antigen is also detected in tissue by the immunohistochemistry. By the using of the immunohistochemistry, we can detect the viral antigen in the tissue by using the virus-specific antibody. So this is the simple diagnosis of chicken anemia virus. Like all disease, we diagnosed on the basis of the history, clinical sign, and gross and microscopic and pathological finding. And if we want to detect the DNA of the virus, we readily use the PCR. We readily use the PCR, or by the use of the PCR, we detect the viral DNA. And if we use the immunological method like the immunohistochemistry to detect the viral antigen. In immunohistochemistry, we use the virus-specific antibodies. Then virus isolation can be done in the susceptible cell line. Virus isolation, if we want the virus isolation, so we can use the susceptible cell line. That is the 1-day-old chickens. 1-day-old chicken or chicken embryos. We can use for the virus isolation. That is the 1-day. We use the 1-day-old chickens or the chicken embryo, which must be virus or virus and antibody negative. We use for the virus isolation 1-day-old chicken and chicken embryo. They are virus or antibody negative. Mostly virus and viral antibody negative. Method for the serological identification of the chicken anemia virus. Infection include ELISA, indirect immunofluorescence, and virus neutralization test. Virus neutralization test. For the immunological techniques, we use the ELISA, indirect immunofluorescence, and virus neutralization test. So this is the diagnostic method that for the conformational diagnosis of the viruses, that we can use the virus isolation, and the virus isolation is done in the susceptible cell lines. And for the cell lines, we can use the 1-day-old chicks or a chicken embryo. We can use the 1-day-old chicks or a chick embryo. Which chick or chick embryo must be virus and viral antibody negative. Then next is the serological identification, includes the ELISA, direct immunofluorescence, and a virus neutralization test. So this is the diagnosis of the chicken anemia virus. First one is the based on the history, clinical sign, gross, microscopic, and pathological finding. Then next is the if we want the conformational diagnosis, so we use either the isolation of the DNA of the virus, or detection of the virus in the tissues, and by the isolation of the virus in the cell line. So for the conformational diagnosis, we can use the PCR or immunohistochemistry. in tissue. Immunohistochemistry in tissue. In immunohistochemistry, we can not isolate the virus or cannot use the DNA of the viruses. They directly detection of the virus in the tissue. Next is the next method that we can use the virus isolation. For the conformational diagnosis, we can use virus isolation techniques, and for the virus isolation, we bond to the susceptible cell line. For the virus isolation, we needed the susceptible cell line, and in the chicken anemia virus, we can use the 1 day old chicks or chicken embryos. And by the other method, we can use like the immunological method or serological method. We can use like the ELISA, indirect immunofluorescence test, or virus neutralization test. So this is the diagnosis of the chicken anemia virus. And other technique we can use for the diagnosis of the chicken anemia virus, that is the viral DNA. Viral DNA can be demonstrated in bone marrow and thymus. And also method we can use the dot plot technique or in situ hybridization. So other method, that is the other methods, that is other method, that is the in situ hybridization. In situ hybridization technique, and the dot plot hybridization. In situ hybridization technique and dot plot hybridization. Hybridization technique. So this is these technique can also used for the virus isolation by directly by the tissue samples. And sometime we can also use the technique, that is the directly isolation of the antibody from the serum of the birds, infected birds. So serum antibody also detected or isolated from the infected birds. Serum antibody also detected or isolated from the infected birds. So this is the diagnosis of the viral anemia, chicken anemia virus. Then the chicken anemia virus is only avian circoviruses that can be efficiently propagate in the cell line culture, specifically in the lymphoblast T cells and B cell line. Lymphoblast T cell line or B cell line. This is the only avian circovirus. Avian circovirus. Okay, so this is the diagnosis, and then the vaccination of the chicken anemia virus. Several commercial vaccines are available and are mainly used in the broiler and breeders. Then we revise the lecture, that is the Circoviridae family. Today's lecture we discussed about the Circoviridae family. Circovirus is the smallest known DNA virus, smallest known DNA virus, and the Circovirus is the or Circoviridae members are the non-enveloped virus or single-stranded DNA virus. They have 17 to 22 nm in the diameter, 17 to 20 nm in the diameter, and pH ranges for the growing in the environment, that is the 3 to 9 pH. And resistant, the Circoviridae members are the resistant to high temperature, that is the 60 degrees centigrade for 30 minutes. These circovirus replicate in the nucleus of the dividing cells. Mostly circovirus infect chickens, pigs, and plants. So chicken and the pig disease are important about the Circoviridae family, and the hydrosymmetry of the Circoviridae family. And then we discussed about the chicken anemia virus. Chicken anemia virus diameter is the 17 nanometer. Chicken anemia virus diameter is 17 nanometer. Then discussed general features of the chicken anemia virus, that is the infection occurs worldwide. All countries of the world's birds are infected with the chicken anemia virus or avian gyrovirus first. Chicken anemia virus or avian gyrovirus first. Causative agent of the chicken anemia virus, that is the chicken anemia virus or the avian gyrovirus first. Avian gyrovirus first, that is the member of the Circoviridae family. We have this double-stranded virus, which circular genome, double-stranded, sorry, this is the single-stranded DNA. This is the single-stranded DNA virus with the circular genome, The diameter is the 17 nanometer. And the chicken anemia virus infect mostly the young birds. Chicken anemia virus mostly infect the young birds. Mostly infect the young birds, that is the 2 to 4 weeks age. 2 to 4 week age groups are most commonly infected. And the chicken anemia virus transmitted through the vertical or horizontal both routes. Transmission is vertical and horizontal. Both vertical and horizontal transmission is occurs. And most important, chicken anemia virus is the immunosuppressive virus. Is the immunosuppressive virus. Means they suppress the immunity or mostly infect the lymphoid organs. They provide the immunity to birds. So mostly infect the lymphoid organs or immunity producing organs like or immunity producing cells producing organs like the thymus, bone marrow, lymphoid organs, and suppress the immunity of the birds. So secondary infection or secondary bacterial infection also occurs. And the virus is in fact most commonly lymphoid organ, bone marrow, thymus, thymus. Most commonly infect lymphoid organs, bone marrow, and the thymus. And most of the clinical finding general symptoms are seen as like the anorexia, depression, dullness, anemia is important feature of the important characteristic clinical symptoms of this disease, and name of the disease is also that is the anemia. So anemia is occurs in this disease. Anemia is occurs in this disease. And the diagnosis of the disease on the base of the history and the clinical symptoms. Some of the clinical symptoms seen in this disease, like the birds are not eat, and the skin color of the birds is the pale, pink to converted pink to pale. That is because of the anemia, and then the diagnosis. Diagnosis is based on the clinical symptom history and the clinical symptoms and some of the pathological findings. That is the hemorrhages of in the subcutaneous tissue and all. If the bird is died and postmortem is the done, so hemorrhage is found in the all muscles and lining of the epithelial lining of the organs. Hemorrhages is found. So this is the chicken anemia virus. Next lecture we discussed, I think, about the RNA viral disease. Thank you.